Hello everyone, this is Dr. Kasia Kynes and we're talking about COVID and EBV connections, what we need to know, what the studies say. Let me pull up the Facebook on my computer. I'm on the phone here so I can look at the studies on my list that I want to discuss. Let me just see here if anyone is live with us. There you go. So I'm going to look at the chat on my computer. If you have questions, if I have answers for you. So let's jump right in. We're going to talk about a couple of things. Michelle, hello. We're going to talk about whether COVID can lead to EBV reactivation, whether there is any difference in mortality rate between people with EBV versus people with EBV and COVID, or COVID without EBV. We're going to talk about long COVID, long-haul COVID and EBV, and some general studies that are connecting EBV and COVID. So, and then I'm going to also give a couple of examples or reference from our community, our students, what we hear, anecdotally hear. So let's jump right in. Hello, Mary. Let's start with, can COVID lead to EBV reactivation? So studies are starting to emerge. It's commonly recognized already in the studies that COVID-19 can reactivate latent viruses, not just EBV. Other viruses that have been reported are varicella zoster, herpes viruses. So that's, we know that. Now, let me see here. And we also have studies, especially from last year, more studies from last year, looking often in Hunan, looking at COVID cases hospitalized in intensive care units and seeing the pattern. So for example, there's one study stating that more than 55% of COVID hospitalized patients also had reactivated EBV. So this was Wuhan University Hospital. Let me see. This was a 2-month period from 2020. So it's a prospective study looking at what happened before. And so 55.2% of the COVID group also had co-infection with EBV. Interesting, this was based on VCA IgM antibody, which is interesting. So they may have missed more because I would be looking more at early antigen as a reactivating antibody. So let me see here. They also had a list of symptoms. So if you had both, if you have COVID and EBV, you had more likelihood of having fever, dry cough. Otherwise, the symptoms overlapped. So you could have fatigue, myalgia, lack of appetite. So myalgia is like muscle pain. The co-infection group had 3.09 times, so 300% risk of developing fever than the COVID group. Let me see, they also did blood tests, and to summarize, immune cell function in the co-infected group was generally a little bit lower, but not statistically significant. One thing that was of note was that the two liver enzymes, ALT and AST, if you're familiar with that, were higher in the co-infection group. That makes sense because, you have more infections, you're fighting more. Hello, Mariana, Robin. Hi. So, yeah, the liver has to work harder when you have more infections. You'll be happy to hear there was no statistical significance in the prevalence of patients going to the intensive care unit, in that no patient died in that study group. That's always good. So let me see if there's anything about that. The group in that study, they looked at the reports, and the co-infection study was more likely to get corticosteroid therapy. It's interesting because corticosteroid therapy is one of the go-to therapies for COVID, but it's one of the worst therapies that you can do for EBV most of the time. So that's interesting. All right. Another study looked at EBV, cytomegalovirus, human herpes virus 6, reactivations in critically ill patients with COVID. So that's another severely impacted group in intensive care unit. And so systemic reactivation of hyperviruses may occur in intensive care unit patients and is associated with morbidity and mortality. In other words, if you already were in intensive care unit and you had COVID and then you had herpes viruses on top of that, you had a higher risk of dying. So they were looking at 34 patients. This was severe. There were acute respiratory failures. You know, there were problems. So anyway, in this group, they found that 82% of that severely impacted COVID group in intensive care unit, 82% had EBV, while only 15%, 1.5, had cytomegalovirus and 22% had herpes 6. So very big difference, right? Hi, Kim. Hi, Jennifer. So another study also from 2021. This is about, again, critically ill patients with acute EBV, COVID and EBV. Again, critical cases from intensive care unit. Interesting, right, that they're tested. The conclusion was that those with concurrent EBV and COVID had higher 28-day or 14-day mortality rates and received more immune supportive treatments than those with COVID alone. All right, let's move to a famous study that made some waves last year. Actually, literally 12 months ago is when it came. Good morning, Jennifer. This is the famous study on long haulers. Is anybody familiar with that study? Long haulers with COVID. So this is very interesting. They looked at a group of people with long haul COVID. And they tested properly for EBV. They found that nearly 73% in that group had reactivated EBV. That's very interesting. So here's what they did. They did test at least 90 days after testing positive for COVID. So 73% of COVID patients who experienced long COVID symptoms were also positive for EBV reactivation. That's a quote. So in that case, if you have COVID, if you know you have COVID and you have history of EBV, you want to make sure that you do everything that we teach to prevent reactivation of EBV. And we do have reports, anecdotal reports, because we did not ever do any formal study in our community, that the protocol that we provide helps if somebody has to go through both. But you want to test if you or also you can go by your typical symptoms of EBV. If you know your EBV and you know what reactivation feels like, you're gonna know. So the question is, what's first, the chicken or the egg? The question remains whether it's just viruses reactivating each other, and what is first. Obviously, I think COVID is first, and then EBV reactivates. EBV is opportunistic, so it will reactivate. And as I mentioned, co-infections with COVID are common. Co-infections are common. If you have EBV infection, you can get all kinds of other infections as well. It's common. It's called transactivation. You can have, you can have EBV and get H. pylori infection or strep or staph. It's just kind of a party time for different viruses and bacteria. Hi, Holly. Good to see you. And Kathy. Okay. So this is a big study. And you want to discern whether your symptoms are actually COVID. I think our antiviral protocol is so strong that it may support people with COVID. We hear good things. I can't make any claims because we're focusing on EBV in particular, but it's very supportive. So I think if you focus on EBV, you might be able to heal faster, turn off the EBV and heal faster for COVID. That would be my educated guess, without us, doing proper studies and publishing them from our community. Okay, so we talked about one aspect. Let me see if I missed something here. We're going to move on. Okay, we talked about all these. Oh, there is a bad study from this year, April, so just 2 months ago. But I want you to keep in mind this is severe COVID cases, severe. So this is, when people die. So this is again retrospective study looking at numbers. Again, Wuhan Hospital, China, Wuhan Infectious Disease Hospital. They looked at the period of January 1st to March, January through March 2020. They looked at over 1,300 cases of patients with confirmed COVID-19 who either survived or died during that period. And basically, I'm going to quote from the summary of the study: a high proportion of COVID-19 patients in that group had EBV reactivation that may be associated with an increased risk of death. So let me see. They looked at, so 55 out of 217 people in that group had EBV reactivation. That was 25.3%. Much lower than the other studies. Reactivation of EBV was associated with age, the older, the more, and gender, more for females. And early antigen levels, that's the reactivating antibody. The early antigen levels were significantly higher in non-survivors than survivors. They also treated the group with ganciclovir medication, and that seemed to improve the survival rate in the group. So that's not, that kind of an alarming study saying, hey, if it's really, really severe and life-threatening, I think EBV should be tested. And they're starting to test, retrospectively. So China was testing EBV already, last year as well. So that's the studies we have, mostly from China. So then, if we did talk about that. Now, we're going to move to a slightly different topic. I talked about this, I talked about that. Okay. So, there is a question. A lady who was assisting me in my home came down with COVID last month and hasn't been sick back since. How long do I need to stay away from someone like this diagnosed with COVID to make especially sure I am protected? Are people with long-haul COVID still infectious? Is long-haul COVID mostly reactivated EBV? Jennifer, these are excellent questions. These are the questions that we don't have the answer yet to. It's not clear. These are budding studies making connections. We don't have too many studies yet. Well, yes, Holly, I can see your comments too. So let's talk about vaccination. We can talk about two things: vaccination for EBV and efficacy and where the studies are, and the vaccination for COVID and how they relate to EBV, what the studies are saying. So why don't we start with COVID vaccination? Can the COVID vaccination reactivate EBV? And so the studies are starting to come confirming that the COVID-19 vaccination can lead to EBV reactivation. There is a study from 2022, a new study. Let me see what it says. The COVID vaccination led to significant, quote, increase in the presence of the virus, in the EBV virus in the blood, and even to EBV reactivation in some cases in that particular group. It looks like it's a polar. Sorry about that. In the group of 10, this is a small study, so it's like, it's starting to come, but it was a study of 10 liver and kidney transplant patients. So these are really compromised individuals. These are not like, us just getting COVID or getting vaccination for that. These are transplant patients. So 9 had a significant increase in EBV in the blood, 9 out of them. And one, the last one, actually, he had previously been negative for EBV for extended period of time, and that particular one person had reactivation of EBV. So pretty much the whole group had markers for increase in the blood, but one reactivated. Now, anecdotal evidence is something that is not studied, and the perfect community is our EBV community. So we talk a lot, we discuss this issue, so I hear a lot, I get a lot of emails, a lot of questions, so I kind of see the pattern. So of course, my perception is skewed, not objective, because people that come to me already have EBV. With that, we have to filter through that. This is already an EBV community. So my anecdotal evidence is the feedback we're getting. It's not uncommon for a person with chronic EBV history get COVID vaccination, and then after that be thrown in the pits of a really, really aggressive EBV reactivation. So that's more common than not. I had literally 3 or 4 stories when it went the other way, when it felt like the COVID vaccination gave somebody an immune reset and the person actually arrested all kinds of processes and symptoms. And it was like, I finally can breathe. So that's rare and far between, and we don't really understand how that works. And some people don't have issues post-vaccine, but I think, the kind of general feeling in our community is be cautious if you have to vaccinate. If you do, take precautions and make sure you're on our protocol and take care of yourself, and don't let the reactivation of EBV happen. And now the last piece of training today is EBV vaccination. Where are we with that? Are we going to do that? And is that good for you? And is it going to be helpful? So there is a new study, they've been waiting for studies. Researchers have been dreaming of EBV vaccination because EBV is actually a global problem. So there is a new phase 1 open lab study underway. It is sponsored by NIH and National Institute of Allergy and Infectious Diseases. Let me tell you a little bit about it. They're using something called GP350 ferritin nanoparticle. It's very different. It's experimental, and I'm going to write more blog about that so you can read later. So the trial will take 4 years. Participants will receive repeated shots. And there were some initial study, this GP350, it's a glycoprotein in monkeys. It protected them from developing lymphoma after exposing them, poor things, to high dose EBV. There was only one human study on GP350. It showed 78% reduction in mono, but it did not prevent EBV infection. And I'm not quite understanding what they mean. I was trying to find details on that, because mono is EBV infection, so the medical community is not, they're using different terminology. So the challenge with a vaccination like that is it takes 4 years. It targets B cells, and B cells are the commonly infected cells, but the virus can also target T cells. These are other immune cells. So that's not considered in the study. And we don't know if it's going to be long lasting, if you have to rely on these. We don't know what other shifts in immunity these will produce, and it doesn't give you any sustainable tools that you can use individually, independently. It doesn't rebuild your system necessarily. So it doesn't teach you how to prevent reactivations of the virus, which we actually do. We have all the tools, and you don't have to be sick. You can stop the reactivations, and you can prevent reactivations in future. So what I'll do is I'll put this in a blog, so there are references and links to studies, and yeah. So basically, to summarize, COVID and EBV happen quite frequently, maybe more frequently than we think. Long haul COVID may actually be no longer COVID. It may actually be EBV reactivation. We'll probably see more studies on that. And there's higher risks with your health when you have COVID and EBV, and so consideration if you still need to vaccinate. If you haven't, you probably will reconsider seeing what we see in literature. So that's what I have for now. And Jennifer, I'm sorry I don't have black and white answers for you. It's kind of a gray area. With COVID, the 4 weeks is typically what they say, right? Quarantine. So if there's no other questions, I'm looking. That's the training for today. I hope it was helpful, and we'll keep you safe. I'll see you here next week. Be well. All the best.